Welcome to the ACEIT podcast, where we turn science into sense. This is our 12th season of ACEIT, and we're brought to you via the Justice Community Overdose Innovation Network, or JCOIN. I would like to celebrate a bit this season, for as we start season 12, we've reached 21,000 downloads and counting. Woohoo! Yeah, not because we're famous, certainly not, but because that means at least 21,000 times our listeners have learned something about overdose, opioids, opioid use disorder, medication-assisted treatment, and/or harm reduction. And that, my friends, warms my very grateful heart. Also, just a quick plug for a few other JCOIN features that you might not know about. Did you know you can get technical assistance for your organization from the experts at JCOIN for free? And did you know you can apply for small research grants to help fund innovative study ideas? Yep, through JCOIN. And did you know you can apply to be a JCOIN Leap Scholar or investigator to improve your own skills? Also through JCOIN. If you didn't know about these things, check out our website, JCOIN-CTC.org, and learn about the many JCOIN offerings beyond ACEIT that may help you learn and grow in ways that improve lives. With that, I'm honored that you're with us. I'm Danielle Rudes, your host, and this is ACEIT. Here we are again on the ACEIT podcast, season 12. This is episode 5. In this season of the ACEIT podcast, we're talking about roles, responsibilities, and reactions to overdose. And you know what I mean by now. We're going to examine how people in different environments and roles prevent and/or react to overdoses. Today, we're jumping right into emergency department, or ED, doctors and nurses' experiences treating patients who have overdosed and/or who abuse drugs. The Center for Disease Control and Prevention, CDC, tracks non-fatal overdose, ED, and inpatient hospitalization data and reported that in 2023, over 130,000 people were admitted to emergency departments after an opioid overdose. Now, only 28 states report their data to the CDC, meaning that in reality, this number is actually far higher. Across multiple studies, researchers have examined the experiences of patients and staff in the ED, shedding light on the challenges, stigma, and opportunities in treating opioid use disorder and preventing future overdoses. Today, we're going to break down what that research tells us about patient perspectives, provider attitudes, and the future of harm reduction strategies in the emergency department. Let's get into it. First, let's review what we know about patients' perspectives. When someone survives an opioid overdose and ends up in the emergency department, what kind of experience do they have? According to a study by Hawk and colleagues, 2021, the researchers interviewed 24 ED patients receiving care after an opioid overdose. Many patients reported feeling stigmatized by ED staff. Some said they felt like, quote, a waste of time, unquote, while others described feeling objectified, more like a problem to be managed than a human in crisis. But here's the key takeaway. Patients overwhelmingly said that empathetic listening from ED staff made a huge difference. When doctors and nurses approached them with compassion rather than judgment, they were more open to discussing treatment options. This highlights a fundamental issue. Stigma in emergency care doesn't hurt feelings. It creates barriers to treatment. Okay, now let's talk about harm reduction measures in the emergency room. One of the most effective harm reduction tools is take-home naloxone. Holland and colleagues, 2019, interviewed 25 Australian ED doctors and nurses to understand how they felt about distributing take-home naloxone to patients, since the emergency department is a, quote, ideal setting due to regular encounters with patients who had experienced an overdose. The majority supported it, but there were concerns. Some staff worried that giving naloxone would encourage riskier drug use, while others were concerned about the financial burden for patients or whether naloxone would be useful if the person lived alone. There was also a lack of clarity on who providers should prescribe naloxone to, especially since there were oftentimes a lack of medical history for most patients. Many staff wanted more clear protocols for distributing naloxone. However, they also said that the ED was not necessarily always a suitable place to distribute naloxone because counseling on it takes a lot of time. and that staff would need more training before fully rolling out naloxone distribution. Despite these concerns, though, doctors and nurses acknowledge that these barriers pale in comparison to the reality that naloxone saves lives. Another way to address overdose and opioid addiction is medication-assisted treatment, specifically buprenorphine. Studies by Dong and colleagues 2021 and Schoenfeld and colleagues 2022 explored emergency physicians' perspectives on prescribing buprenorphine. Dong and colleagues interviewed Canadian ED doctors and nurses, while Schoenfeld and colleagues interviewed ED doctors and nurses in the United States. Both studies' findings were revealing. First, access to training and protocols was a huge factor. Physicians who had training in addiction medicine or harm reduction were more likely to offer buprenorphine. Those who didn't, they often viewed it as outside the scope of emergency care. Another major barrier was the perception that buprenorphine is just, quote, substituting one drug for another, unquote. This stigma remains a significant challenge despite overwhelming evidence that MOUD, or medications for opioid use disorder, reduce overdose deaths and improve patient outcomes. A solution? Standardized training and clear guidelines. Physicians who had structured protocols with addiction medicine specialists to consult were far more likely to initiate treatment. Without these supports, many providers felt overwhelmed or uncertain about providing buprenorphine. A final ED harm reduction measure is distributing fentanyl test strips to patients who use illegal opioids. A study by Reed and colleagues in 2023 explored how ED staff felt about giving out test strips to patients. The response was largely positive. ED staff reported believing that distributing test strips empowered patients, showing them that the healthcare system respected their agency and safety. Some providers, however, were hesitant, believing that test strip distribution might contradict the physician's goal of getting their patient to quit using drugs. The biggest challenge that staff noted to distributing test strips was logistics. The emergency department is a chaotic environment, and staff often don't have the time for sensitive conversations about harm reduction. The study suggested solutions like triage screenings for drug use, posting flyers and advertising test strips around the department, and involving nurses or recovery specialists in test strip distribution to ease the burden on doctors. Okay, so what's the bottom line in all of this research? Well, the emergency department is often a turning point for people who use drugs. By shifting attitudes, improving protocols, and embracing harm reduction, emergency rooms can become more than just a place where overdoses are reversed. They can become a gateway to lasting recovery. And with that, we've reached the end of our episode on ED doctors and nurses' roles, responsibilities, and reactions to overdose. I hope you learned something from this episode, and I'll talk to you next time, where we will be talking about the experience of staff who work in prisons and jails and their perspectives on overdose. Thank you for listening. I'll talk to you again soon. Thank you for listening to the Aced It podcast. We love hearing from you. So if you have comments, topics to suggest, or some science you'd like us to cover in a future season, please write to me, Danielle Rudes, at Sam Houston State University. My email is drudes, D-R-U-D-E-S, at shsu.edu. And of course, thank you to the Justice Community Overdose Innovation Network, or JCOIN's Coordination and Translation Center, funded by the National Institute on Drug Abuse, housed at George Mason University, where this podcast originated. Thank you to our fabulous scriptwriters and also my fantastic doctoral students, Bryce Kushmerek-McCune and Jalen Magana. And a huge and heartfelt thank you to the team at Slonky LLC for their wonderful production as always. Remember to check out our website, JCOIN-CTC.org, for more cool JCOIN features and opportunities. And tune in again soon for another episode of Aced It.